Hello again. I wanted to talk about starting solids. We had a request on Facebook to discuss this a little bit, and it's a great topic. So when I talk to families about starting solids, I usually recommend starting anywhere from 4 to 6 months of age. Um, it's usually in this age range that babies develop an interest in eating solids. They develop the muscular strength to be able to eat solids, and then their bodies are just at a place where they're able to digest the solids well. A couple things or a couple clues or signs that your baby might be ready for solids. Um, if they're able to sit up and hold their head and neck up well, um, and then the other thing that they'll start to do is they start to show interest when you're eating. So they actually will sort of watch you eat. Some babies will sort of stare intently and even open their mouths as you're eating your food. So those are some good signs that they might be ready to start. Um, if you decide to start solids earlier than 6 months, just keep in mind that you really won't see your baby decrease the amount of formula or breast milk that they're eating. They still usually take the same volume of milk if they start eating solids before 6 months. And then as they get older, they'll decrease their volumes of milk as time goes on. The biggest things to keep in mind, one is never give your baby honey. Any baby less than 12 months should never have honey. There's a risk of a disease called botulism that can be transmitted through honey, and babies less than 1 year should not get it. And then the other thing to keep in mind is be really careful about choking hazards. So don't ever give your baby something that he can choke on. So like hot dogs, whole grapes, nuts and seeds, big chunks of meat or cheese, popcorn, candy, marshmallows, basically bigger, chunkier foods that can get stuck in their airway. So now, talking about things that you can give your baby. So start with pureed foods. Start with foods that are the consistency of applesauce so the baby can easily take the food in while they're learning to chew and then swallow it. When you first start solids, you may notice the baby doing the tongue thrusting movement. It's a reflex that they do so that they can nurse or take a bottle. If every time you give your baby a solid, they do the tongue thrust, they're basically just going to spit the food out. And if they're doing it often, it may be a little bit early, and you may want to kind of take a break and try again in a couple weeks, because that tongue thrust can be really messy with purees. You can give foods in any order that you want. So a lot of families will start with rice cereal, but you don't have to. You can start with any pureed food like pureed vegetables, pureed beans, rice cereal, oatmeal cereal, pureed fruits, so lots of choices. The other thing that I talk about is peanut butter. So there was a really big study called the LEAP study, learning early about peanut allergy. It came out a few years ago, and basically it showed very clearly that if you introduce peanut butter early to infants, you decrease their risk of peanut allergy. So if your baby is not high risk for peanut allergy, you should expose them early to peanut butter. Babies that are considered high risk, just a couple things: babies that have severe eczema, history of egg allergy, if there's a big family history of peanut allergy. If you have any kind of question, then just call us and ask if your baby is high risk. But for babies who are not, peanut butter is a great early food. I just say if you have really thick peanut butter, water it down or mix it in pureed bananas or rice cereal so they don't choke on it. Another piece of advice that we give is to give single ingredient foods one at a time. This is kind of one of those things that we've always said to do. There's not a lot of evidence that you have to, but by giving kind of just peas for a couple days or just carrots for a couple days, as you introduce new foods, If a baby has a reaction, it's much easier to kind of narrow down what they're reacting to if you're just giving one single ingredient at a time. As they move along with foods, babies are ready for finger foods, so kind of bigger, chunkier foods. When they're sitting up well, they're getting better at their fine motor skills, so getting better at using their fingers and hands, and starting to chew. So they don't really get those skills till closer to 8 months, so something that happens a little bit later down the line. But once they are ready, things like cooked or scrambled eggs, beans, well-cooked rice or pasta, pieces of cheese cut up, cottage cheese, those are all great foods. Just to make sure that they're well cooked and cut into small pieces so they're not choking hazards. And then also be careful that none of the things have any sort of honey as an ingredient. And then last, when babies are ready for pureed foods, they're also ready to start using a sippy cup. So babies older than 6 months old can start using the sippy cup, and you can offer them water. So water is great to help with digestion, great to keep them hydrated. Juice really doesn't have any nutritional value, and it ends up being a lot of sugar. So I usually say to just do water in the sippy. So that is some information about solids. I hope it was helpful, and please let us know if there's anything else you'd like to learn about. Thanks for watching.